Hey guys, my name's Sam and welcome to Prep Medic. In this week's video, we're taking a look at the US Air Force JFAK. So the JFAK stands for Joint First Aid Kit, and it has officially replaced the Air Force's individual first aid kit. The thought with this kit is that it's universal through the entire Air Force. Everybody has it, they all have universal locations for it, and it comes with a very standard set of equipment. So this is mainly a basic life support kit. However, it does have a couple more advanced things in it and comes with a couple unique features I think you guys are gonna like. So to start out with, the bag itself is a pretty generic bag. Now this is their camo pattern. It's got the MOLLE attachments on the back, has some areas to attach things like tourniquets on the side if you so chose. And then it has a front flap with a compartment in there that holds a TCCC card. So in the front, like I just said, this is the TCCC card. Now this is just a really quick casualty listing roster essentially. It has where they're injured, you can circle certain things, fill it out pretty quick, and then it's really good for a patient pass off. Now, obviously, this is not good for all situations. They're not going to be like, ducking from gunfire trying to fill this out. But this does help for patient transfer. You write like your name of the medication you're giving, blood products you're giving, fluid, anything like that. So then the receiving hospital has a documented list of everything you did for that patient. The other thing about this kit is that the kit itself doesn't come with the tourniquets. They issue those separately. So this one has 2 tourniquets with it, and these could be mounted right on here, or they could be mounted somewhere else on the kit of the airman. Now, coming into the bag itself, it just has one heavy-duty pull zipper and opens up pretty standard like most IFAKs do. And like I just said, this can be mounted on the vest. You can kind of access it down there or potentially on a belt. In here, in the top, we have a Sharpie, so this can be used to fill out that card I just showed you. Can also be used to mark your tourniquets or mark your casualty, whatever it might be. Sharpies are a really good thing to have, and this is just a mini one here. It has 2 eye shields in it, so for your eye injuries, blast injuries, very common in those situations. You can cover their eyes with these, wrap them up. Literature varies whether you're supposed to cover both eyes if one eye is injured or just cover one. Regardless, if you have an injured eye, it's best practice to cover it up, but you don't want something that's just pressing on it. So this eye shield actually keeps your bandaging off the eye itself so you're not causing more trauma. In the back, this has 2 H&H combat dressings. So these are just trauma wraps. They're pretty tiny. You've seen these on this channel before, but essentially they have a big H strap on them that allows it to be wrapped a little bit tighter. You wrap it around, come back, and then pull it really tight so it provides a lot of pressure. So this is a pressure dressing. Can be used for your more minor cuts on the arms, legs, head, anything like that. But then it can also be used to hold in your packed sites at your junctional injuries if you have had to pack a wound. So really good thing to have, and this one actually comes with 2. So this kit's a little bit bigger than it looks like to begin with. So coming to the bottom of the kit here, you'll see here we've got 2 sets of just H&H Z-fold gauze. So this gauze doesn't have hemostatic agents in it, anything like that. It can be used to wrap wounds, it can be used to tie a sling in a swath, it can be used for any number of things, but it can also be used to pack wounds. Now it also comes with 2 pieces of combat gauze. So this is a hemostatic agent. This has an active ingredient in it, it's a mineral that helps clot junctional hemorrhages. So we're really packing wounds on the junctional sites of patients. So that's base of the neck, the armpit, and the groin are the most common areas. And then if you don't have a tourniquet, you can opt to pack the wound instead of applying a tourniquet if you don't have one available to you. This is preferable over doing an improvised tourniquet per the TCCC guidelines. So right next to those, you've got duct tape. So duct tape, I mean, it's universal. It works for everything from, fixing a weapon system to a makeshift pressure dressing to, making notes on your pants leg with your Sharpie. So this has a lot of applications. It's cool that they include that in there. And then at the bottom of this, there are 2 sets of North American Rescue Talon gloves. Now, what I really don't like about this is that they've included black gloves with them. Black gloves are not good for these kind of kits because you can't really see bodily fluids on your hands. So if you like do your blood sweep, you're going down and you come out with a lighter color glove, you can see if there's blood on your hands. With these ones, you won't see it as well. And that leaves you open to accidentally wiping it on yourself or getting it on somebody else and just not identifying a bleed. So I'm not a huge fan of black gloves, although they do look pretty cool. So down at the bottom of the bag and coming to some of the end of the contents here, we've got another big pocket. And in here, there is a Gerber tool. And this tool simply has a seatbelt cutter here and a window punch on the other side. So super simple to use. You know, good to have, especially for those potential vehicle extrications. You know, if they're driving around in a convoy, something happens, they can extricate people so long as it's not ballistic glass. Other things in here, we've got an H&H dry sterile burn dressing, and this is also a cravat, so a triangular bandage. This can be used to sling and swath an arm. You can use this as a bandana, but then it's also a burn dressing. So really good for that. It's cool that they include that in here. And then we have a hyphen chest seal. The one thing with this one is that it's not the tinier ones that I like. I like the little bit more compact versions of these because they store a little bit better. And I believe this one only has one chest seal in it. So this is an individual chest seal. If you're carrying these, my personal recommendation is to carry two. So you have one for an entrance wound, one for an exit wound, or just a backup. If you open it up, it gets stuck to itself and you're screwed. So good to have two, but you know, they at least have one there, and that's definitely the minimum. And then finally, down here, we've got an NPA, and I believe this is a 28 French, which is just a common adult size. You know, in the military, they don't have to deal with pediatrics very much or elderly very much. They're basically a very similar body type throughout the military. So one size fits most, but not all. And then, of course, it comes with a little bit of lubricating jelly here. The two tourniquets that they're using, these are just the cat tourniquets here. So with these, this is pretty standard through the armed forces. They store them well. Notice they folded it well. They have the time strip pulled over just a little bit so it's easy to access, but it's not actually stopping the windlass from coming out. And then these ones are Gen 7s. One point I want to make with the Gen 7s that people were pointing out in one of my other videos, these ones no longer have the double buckle on them. So this is a single buckle. You know, they used to say for leg injuries, you want to feed it through one, down the other. They've really stopped doing that. There's just one buckle on this, works for both legs and arms, and you don't have to mess with it. So I really like the improvements on these Gen 7s here. Guys, I'd really like to thank my friend who supplied this for me. This is his personal JFAK. He's not on assignment right now and was like, hey, you want to do a video? So I really appreciate that. Give you guys a look at what some of our armed forces are carrying. You know, you'll see that it's pretty in line with everything I've been showing you on the channel. You know, these things don't vary all that much, but I definitely like some of the extra things they've thrown in here, like the eye shields, the burn dressing, cravat. Those are really nice touches in this kit because it can treat a wider range of injuries than just your massive hemorrhage. We can actually do some basic first aid and make people more comfortable. If you have any questions, guys, please leave them in the comments down below, and I will see you next week.